Good day, everyone. I am Logie Strada Pamimis UBS and 1, and today I am going to perform positioning. So it entails preserving a patient's neutral body alignment by avoiding hyperextension and severe lateral rotation in order to avoid the problems of immobility and injury. So patient positioning is an important part of nursing practice. Positioning patients in most circumstances provides airway control and ventilation, as well as body alignment and physiologic safety. So this is to keep your body aligned, to avoid contractures, to encourage drainage, and to make breathing easier. So prior to the conduct of the procedure, I am going to close the door to secure patient's privacy. I am going to need to provide an adequate lighting and adjust room temperature for patient's comfort. I am going to prepare now the equipment to be used, which are the bed boards. So, assuming that this is the bed board, then we have the pillows and the stirrups. So we have the stirrups here, and also the trochanter rolls. We have here the trochanter rolls. Then we have the considerations before, during, and after the procedure. So before the procedure, you must guarantee that all necessary equipment is available, then maintain a level of privacy, and also during the procedure, always remember proper body mechanics to prevent overstretching or body straining, and make sure to do so. Then, always remember proper positioning techniques for patient's comfort and follow the necessary standard correct procedure in doing so. So, after the procedure, you must document the result. So, things to document after the procedure. So, we have to record the procedure done in patient's positioning. Then, do hand washing or apply alcohol. So, hand washing or hand hygiene prevents the spread of infection. Okay, so now I am going to introduce myself to my patient and verify his identity, and of course explain to him the procedure that I am about to do. Good morning, sir. I am Logie Estrada, your student nurse for today. May I see your wristband, please? Okay. Please state your complete name and your birthday, please. Okay, thank you. So now I am going to perform you a positioning. Is it okay with you? Okay. So first, we must perform a supine position. This is for physical examination, resting in bed, and undergoing anesthesia. Okay, so now I'm going to put my patient in a supine position. Okay, sir, please put your hand right here. So now my patient is in a supine position. So now let's move on to a prone position. So this is lying on stomach with head turned into the side. So this is to improve oxygenation in patients with acute respiratory distress, to relieve pressure on the back, pockets, and hips. So next, we are going to put hip in a prone position. Okay, so sir, I'm going to remove your upper sheet. Okay, sir, please put your hand right here and please move. So this is now the prone position. Okay, so now I will put my patient into a dorsal recumbent. So this is lying on the back with arms at sides, legs apart, knees bent, and feet flat on the bed. So this is for physical assessment of abdomen and genitalia, perineal care, and examination during labor. Okay, now sir, I am going to put you in a dorsal recumbent position. Please put your hands on your side and yes, sir. Just do that. Okay, so this is now the dorsal abdomen position. Okay, sir, please relax now. So now let's move on to the Trendelenburg position. So this is lying on back with arms at sides, bed position, so foot part of the bed is higher than the head part. So during some abdominal surgeries to shift abdominal contents upward. Okay, now sir, I'm going to put you in a Trendelenburg position. So I will be putting this for his head assistant. Okay, so now sir. So, so assuming that this is the position, so please straighten your body, sir. Please straighten it. Okay, like that. So this is the Trendelenburg position, like this. Okay. Then we will move on to the reverse Trendelenburg. So this is lying on back with arms at sides, bed position so that head part of the bed is higher than foot part, but no flexion at waist. So after certain angiography procedures allows head of bed to be elevated without causing pressure on the femoral artery. So during certain abdominal surgeries to shift abdominal contents downward. Okay, now sir, I'm going to put you in a reverse Trendelenburg's position. So this is for your assistant. Okay, please straighten your body. There. So here is the reverse Trendelenburg's position, like this. Okay, thank you, sir. Okay, so moving on to the lateral position. So this is lying in the left or right side, supported behind back and between knees and ankles with pillows in good body alignment. So this is for patient comfort and to promote lung and cardiac function, and also to relieve pressure on bony prominences of the coccyx and sacrum. Okay, now sir, I'm going to put you in a lateral position. Please this side. Okay. So this is the lateral position. Okay, sir. That. Okay, so this is now the lateral position. Next, we are going to perform the seams position. So this is lying on the left side in semi-prone position with right leg flexed and drawn up toward the chest. The left arm is along with the patient's back. So this is for rectal examinations and administering enemas. Okay, so now I'm going to put you, sir, in a seams position. Okay, now, sir. Please relax. Okay, sir, I'm going to put you in a series position. Please. Mhm. Like that. So this is now the same position. Okay, sir. Okay, so now let's move on to the low Fowler's position. So the head of the bed elevated in 30 degrees. This is to prevent the aspiration during tube feeding. Okay, so the 30 degree is here. Okay, so this is now the 30 degrees. So this is the low Fowler's position. Then we have now to move on to the semi Fowler's position. So the head of the bed elevated in 45 degrees. So this is to comfortably watch television or converse with the visitors. So after abdominal surgeries, to relieve tension on incision and also to assist the patients who have difficulty breathing. Okay, so I am going to put you, sir, in a semi-Fowler's position. So for 45 degrees, so this is now the semi-Fowler's position. Then now we are going to have the high Fowler's position. So the head of bed is elevated in 90 degrees. And also this is for eating and drinking without risk of choking. This is to assist patients who have difficulty in breathing. Okay, so this is now the high Fowler's position. Okay, sir, please sit there. And okay, so this is now the high Fowler's position. Okay, sir, you may now relax. So now let's move on to lithotomy. So this is lying on back with knees flexed above the hips and legs supported in stirrups. So this is for vagina and gynecological surgery and examination, delivery of neonate, and pelvic and gynecological surgery and procedures. Okay, so now, sir, I am going to put this on the okay, like that. Okay, please, okay. Okay, so please put your hands, please. Okay, so this is now the lithotomy position. Okay, okay, sir, you will now relax. Okay, sir, thank you for your cooperation.